If you've found kittens and have made the compassionate choice to save their lives by fostering them until they're old enough to be adopted, thank you. We hope the information provided to you in this video will help you care for these kittens until they reach an adoptable age. A kitten may need hand-raising because the mother has died, become ill, rejected the kittens, or abandoned them. In the case of feral cats, the kittens may have become separated from their mother. If you have a kitten that has to be bottle-fed, you should be prepared to devote considerable energy and constant care if the kitten is to have a good chance at survival. The younger the kitten, the more fragile it is. Kittens under 2 weeks of age may not survive without a mother, no matter how good the care, but please don't give up. Once your kittens reach 8 weeks old and weigh at least 2 pounds, they can be spayed and neutered and placed for adoption. Remember, never give away an unspayed or unneutered kitten. Giving just one unfixed kitten to someone who doesn't spay or neuter them before they reach puberty can result in hundreds of unwanted kittens being born and then killed for lack of a home. Thanks for watching and for wanting to help be part of the solution of saving lives. It's important to estimate the age of your kittens so you'll know how to properly care for them. There are several developmental signs that can help you determine their approximate age. Weight is also a helpful indicator. Most healthy newborns weigh an average of 3 to 4 ounces and gain approximately 4 ounces per week after birth. All kittens are born blind and deaf. Their eyes are closed and their ears are folded down. If your kitten still has his umbilical cord attached, your kitten is less than 4 days old. Between 7 and 10 days old, his eyes will open, although his vision won't be very good yet. If your kitten's eyes are open, he's at least 1 week old. If his ears are closed and lying flat against his head, your kitten is less than 2 weeks old. By 3 weeks, he'll begin to shakily move about with his tail held up for balance. His ears will be erect, and he'll start getting his baby teeth. He can now see, hear, and smell, and he can purr. Kittens who have teeth and can move about easily are likely 4 weeks old or older. Determining your kitten's age is very important because if your kitten's health is compromised, size alone is not always an accurate indicator. Until they're 3 to 4 weeks old, kittens cannot regulate their own body temperature. As soon as you find an orphaned kitten, it must be protected from becoming chilled. Immediately place it inside your shirt, right next to your skin if there's no other heat source available. If the kitten feels cool to the touch, he needs to be warmed immediately. If you're in doubt, check his paw pads and ears. They should feel warm. If they feel cool, your kitten is chilled. Other warming methods include hot water bottles wrapped in bedding or heating pads. Warming, if necessary, should occur slowly over a 1 to 2 hour period. Healthy body temperature for a pre-weaned kitten ranges between 98 and 100 degrees. Kittens under 1 week will gravitate to warmth since this is their only active sense. Be sure to allow space for the kitten to crawl away from the heat source in case he gets too warm. Never try to feed a cold kitten as he could go into shock. Kittens need to be warm and stable first before feeding. If possible, take the kitten to a veterinarian to be checked for dehydration and general condition.
So in general, I think that most pre-weaned kittens don't really need to be seen before they're about 4 or 5 weeks old. At 4 or 5 weeks old, that's when I can really start to determine, are they developing correctly, are they putting on weight correctly. In some high-risk kittens, you can test them for feline leukemia or feline AIDS. But you really can't do those things before about 4 or 5 weeks old. Reasons to take your younger kitten into the veterinarian are if they fail to put on weight, if they seem to be fading, if they won't take their bottle, or if they regurgitate. Sometimes kittens can start to have problems, and you'll see the milk kind of coming back up out of their mouth or out of their nose. That is a very big deal, and definitely you should get your kitten into a veterinarian right away.
Whether you go to the vet or bring your kitten straight home, the first order of business is providing a safe, warm nest in a clean, draft-free, and quiet area of your home that's isolated from other pets. The ideal nest for tiny kittens is a small, top-opening pet carrier. But any clean container with a lid and sufficient ventilation should work. Young kittens cannot retract their claws and are amazing climbers. Kittens only a few days old can scale the sides of a box by climbing on the bedding, so a heavy or locking lid is absolutely necessary. Keeping the container low to the floor is also advisable as a safety precaution. Besides the container, a good nest requires soft bedding material and a heat source. Bedding should be a light color so that you can see any dirt from the kittens, such as fleas, stool consistency, or urine color. Good bedding choices include flannel, fleece, or imitation fur. Toweling can be used as a base for absorbency and warmth, but because of the loops, it's not the best option. Keep the nest clean by frequently changing the bedding. Layering the bedding contributes not only to warmth and comfort, but allows the top part to be changed when dirty, leaving the next layer. As your kittens begin to develop their sense of smell, this keeps it a more familiar environment for them. During their first 2 weeks, the ambient temperature of their nest should be kept between 88 and 92 degrees. This can be adjusted downward as the kitten gets older, approximately 5 degrees a week, until room temperature. Do not use cow's milk to feed your kitten. Kittens must have formula specifically made for them, like KMR, purchased from a pet supply store. Feeding can be done with a nursing bottle, an eyedropper, or a syringe. Feeding your kittens begins with the proper preparation. You'll need a bottle, nipples, and formula. In an emergency, use an eyedropper or small syringe. Keep bottles, nipples, and mixing utensils very clean. You should wash bottles thoroughly in warm, soapy water before using them, and then after each use. Rinse well and sterilize often. Several commercial brands of kitten milk replacer formula are available as either a premixed liquid or as a powder that you mix with water. Mix following directions on the container using warm water. Thoroughly mix the powdered formula by either stirring or shaking in a glass container. Prepare the nipple by snipping off the tip. You can also cut a small X on the tip. Now, the size of the nipple opening is extremely important. This to allow your kitten to get enough to drink in a reasonable amount of time. Check for proper size of the opening by holding the bottle upside down. The formula should drip out slowly with no pressure being applied. Fill the bottle with formula up to one of the marked positions. Now, this is important to accurately judge the amount of formula consumed by each kitten. Prepare only as much formula as can be used in a 24-hour period, and always store the remainder in the refrigerator after opening or mixing. A healthy kitten may not suckle well if the formula is too hot or too cool, if it's spoiled, or if the nipple opening is too small. If you're using a syringe or eyedropper to feed your kitten, be sure to keep the formula sitting in warm water to maintain the temperature as it cools very quickly. To feed your kitten, place it stomach down on a blanket or other textured surface to which it can cling. Never feed a kitten on its back or force feed her by squeezing the bottle, as you could accidentally fill the kitten's lungs with formula and cause aspiration pneumonia. Open her mouth gently with the tip of your finger and then slip the nipple between her jaws. Very gently squeeze just a drop of formula into the kitten's mouth. To prevent air from entering the kitten's stomach, hold the bottle at a 45-degree angle, keeping a light pull on the bottle to encourage vigorous suckling. Placing your fingers on either side of the kitten's mouth also helps encourage suckling. Carefully monitor when and how much your kitten eats. Check the KMR package for recommended feeding amounts and feedings per day. A kitten needs approximately 8 cc's of formula per ounce of body weight per day. The kitten's age determines the number of daily feedings it should receive. This chart gives you an idea of how much formula your kitten should be consuming. When a kitten has had enough formula, he'll stop suckling and his tummy will be rounded. A kitten will usually stop eating on his own when full. After each meal, burp the kitten by holding him upright against your chest and gently massaging his tummy and rubbing his back. Do this after each feeding until he's about 3 weeks old. The tummy should feel firm and bulge slightly. The kitten should fall asleep almost immediately after feeding. The best way to ensure your kitten is getting enough nutrition is to weigh him daily. There should be a slight gain every day and never a loss. Feeding small amounts often is important to maintain hydration as well as nutrition. If the kitten's skin on the back of their neck stands up when gently pinched, your kitten is dehydrated. Kittens can become dehydrated very rapidly and may need subcutaneous fluids injected under the skin to hydrate them. Kittens that have become dehydrated will have very little energy or appetite, so this is important to take care of immediately. Dehydration is life-threatening in a very small kitten. If your kitten is only mildly dehydrated, change the powder-to-water ratio when mixing their formula to 4 waters to 1 powder. That can sometimes help. During and after feeding, the mother cat grooms her kittens. When you feed and clean your kittens, wash their fur all over with a barely damp cloth and use short strokes as their mother would when licking them. This cleans their fur, teaches them to clean themselves, and gives them a feeling of attention and well-being. And this is a great opportunity to bond with your kitten as well as assess his general health on a daily basis. The kitten's natural mother takes care of both ends of her baby. By licking the kitten's lower abdomen, she stimulates the bowels and bladder and tidies up the resulting mess. As your kitten's surrogate cat mom, you'll need to gently rub the kitten's bottom with a slightly moistened cotton ball, tissue, or paper towel to stimulate them to go potty and to move their bowels. Be careful to rub gently. Urination usually begins right away. You should stimulate your kitten to urinate before and after every feeding. A full bladder can be very uncomfortable. Your kittens will need your help with pottying until they're 3 to 4 weeks of age. Urination should be a medium yellow color. Expect a bowel movement about every 24 to 36 hours. If there is to be a bowel movement, you'll feel the kitten's stomach tighten, and he'll push with his abdominal muscles when stimulated. If your kitten is full, warm, and otherwise healthy, but is still restless or crying, he probably needs to have a bowel movement. Stools should be soft, but not runny, and a light to medium brown in color. Diarrhea and constipation are especially dangerous in very young kittens and should be treated immediately. Check stools for blood or parasites on a regular basis and consult a veterinarian if you notice significant changes. When your kitten is about 4 weeks old, provide him with a kitten-safe litter in a shallow litter box. Don't use clay clumping or scoopable litter, as it could clump on their nose or be ingested and make them sick. Use of the litter box is instinctive, though they'll sometimes need your help. Place the kitten in the box after each meal. You can also hold them over the box while you stimulate them to give them the idea. You may have to take the kitten's paw and show it how to scratch in the litter. Most kittens catch on quickly. If they need further guidance, though, try leaving a soiled tissue in the box and they should follow the scent. Kittens are notoriously messy. Elimination will sometimes occur spontaneously and should be cleaned up immediately. If the kitten has diarrhea and becomes caked with stool, it's easier on their skin to wash their bottoms with warm water under a gently running faucet rather than using a wet cloth. Even very young kittens can be bathed safely or given a butt bath when needed. Bathing your kitten may be necessary if your kitten is very dirty or has fleas. Kittens need to be rid of fleas as soon as possible. Flea anemia can hamper any attempt to save the kitten, and fleas carry tapeworm eggs. Using a flea comb is safest, and live fleas can be dropped into a bowl of warm, soapy water to trap them. Use warm water, a washcloth, and a mild soap like Dawn dish detergent. Dawn has been proven safe for bathing even week-old kittens, and it kills fleas. Have plenty of towels ready and a warm, draft-free place to prevent chilling the kitten. You can wet the kitten under a gentle stream of warm water, or dip him in a tub of warm water, but be careful not to get the water near the kitten's face or ears. Wash gently with the washcloth and rinse thoroughly. Use paper towels to blot excess moisture, and then wrap your kitten in a soft cloth towel to dry them. Place them in a warm, draft-free container covered by a blanket until he's mostly dry to avoid chilling. Then brush and groom him gently until he is thoroughly dry. You can use a soft, damp cloth to wipe the kitten's face and ears if necessary. As primary caregiver, it becomes your responsibility to track your kitten's health and be an active participant in his care and treatment. Realize these little orphans have few reserves and a compromised immune system, so quick intervention is needed when you notice a problem.
So we're here today. We're going to take a little look at Spanky, who's about 4 or 5 weeks old. And Spanky has been hand-reared by his owner, and he's looking very good right now. He is definitely appropriate in his development for his age. He's size appropriate for his age. He has good coordination and motor skills, and he definitely understands what's going on in his environment. Hi, baby. He's a little nervous. So we're going to go ahead and take a look at him. I'm going to start out by looking at his ears, and I look from the outside first, and I see that they're very, very clean, which is what you definitely expect. You don't want to see any debris or dirt. And now I'm looking at his little eyes, and I'm seeing he has a little bit of dry discharge on both sides. But when I look at the tissues of his eyes, they don't look swollen, and he doesn't have any active discharge at this point. And when I go ahead and take a look at his third eyelid by just pressing on his little eye, I see that his third eyelids look very, very good, that they're not red or swollen. His little nose is clear. He has good nasal openings, so that's good. And I'm going to look in his little mouth. And his teeth are coming in. At this age, I definitely expect to start to see the canine teeth, which are the long, pointy teeth. And I'm also starting to see the molars, which are a little bit further back in his mouth. And his little mouth looks very, very good. I'm opening it up so I can see the soft palate. There's no defects in the palate, and there's no ulcers on his little tongue. So I'd say his little head looks very good. His neck feels good. I don't feel any masses, and he doesn't cough when I touch. So now we're going to go ahead and look at his fur. And his fur is very good. He has a full hair coat. And when I look on his tummy, they don't generally have as much fur on their tummy, but the skin looks very, very good. There's no marks or cuts or bruises or anything like that. And next I'm going to go ahead and just flea comb him to make sure that I'm not getting any fleas. And actually he does. He has a flea. It's right there. So we are probably going to get him started on some medication so that he doesn't have fleas. We'll get rid of those. And usually we use topical medications, and he's definitely old enough to go ahead and apply those. He is definitely a boy. You can check in the back. And he has both of his testes descended, so things look very good there. Definitely moving very well. Oh, don't be so afraid. It's okay, Tommy. It's okay, Tommy. Okay. So we're going to listen to his heart, make sure that his heart and lungs sound good, and that his heart rate is normal. Heart rates in kittens can sometimes be 200, 220 beats per minute, so it can be really fast. But they're nervous, and that's normal. Most adult cats' normal heart rate is about 140 to 180 beats per minute, so much faster than humans. And his heart sounds really, really good, and his lungs sound very good as well, listening on both sides. Great. We're going to go ahead and take a look at his little paws. I see he has all of his little claws, all of his little fingers and toes. I don't see any dirtiness on them at all. His little paw pads all look very good. They're soft, and he has little pink and gray ones. Very, very cute. So the last thing I'm going to do is I'm going to look down into his ears. Make sure that I don't see any debris deep into their ears. Cats have very, very deep ear canals, and I want to make sure that I'm not seeing anything deeper, even though the outside of the ear looks clean. It's important to look right down. And that looks excellent. And then finally, I'm going to go ahead and feel his little abdomen. It feels very good. I don't feel any lumps or bumps or anything that doesn't belong there. And then we're going to get his weight. Now most, as cats get older, we're certainly going to use a more typical feline scale. But for right now, I'm just going to use this little gram scale because he's so small. I want to try to get a more accurate weight. Put him right in there. And our little friend weighs 1 pound, 2.5 ounces, which is a very normal size for a cat that's about 4 weeks old. Generally, by the time most cats are 4 weeks old, most of them weigh around 1 pound, and in general should be putting on about 1 pound a month, at least. So our little friend right here looks great.
With support and advice from a veterinarian, you can provide basic first aid and health care for your kitten at home. You'll learn to recognize signs of distress and then properly administer medications if needed. Common conditions you might encounter include dehydration, diarrhea, upper respiratory infections, commonly called URIs, and eye infections. URIs are characterized by sneezing, often with nasal or eye discharge. Viruses are usually the cause, and no medication is available which directly affects the virus. But antibiotics may be prescribed to reduce the chance of a secondary bacterial infection. Antibiotics are almost always in liquid form, so medication is administered orally by using a small syringe. As when feeding, place the syringe gently in the side of the kitten's mouth and allow him to swallow the medication on his own. Use a sterile syringe for each dose so that the bottle isn't contaminated. Eye infections may occur in conjunction with a URI or on their own. If there is an eye infection, their eyes may be swollen and you'll see green or yellowish discharge. Gently clean the eyes often with warm water and a soft cloth. If medication is necessary, it's administered as drops or ointment. Ointment should be applied with your finger to prevent contaminating the tube or accidental injury to the kitten's eye. Place the correct dosage on the side of your forefinger and carefully roll it into the kitten's eye. Pull very gently on the bottom lid to ensure the medication is distributed in the eye. Be sure you understand how to store and use medications. Many require refrigeration or might have a limited active shelf life. As always, wash your hands thoroughly before and after each medication dosage. You may begin weaning your kitten when he's 4 to 5 weeks old. Start by feeding him warmed formula in a bowl, and then gradually introduce solid food. Gerber or beechnut chicken meat baby food work very well. Quality canned kitten food could also be used. Offer the wet food to your kitten on the end of your finger. Once you have his attention, move your finger to the bowl. Use a shallow, ceramic, non-tippable bowl, and don't be surprised if the kitten steps right in it. Your kitten should then lick the food off his paws, which encourages interest in the food as well as the beginning of good grooming habits. Offer plenty of fresh, clean water, again in a sturdy, stable bowl. In a few days, you can offer dry food moistened with warm water. then dry food on its own. Royal Canin baby cat is ideal due to the kibble's small size and easy digestion. Don't expect the kitten to be weaned overnight. It can take a little while. As the kittens eat more often from the bowl, you can begin to reduce the bottle feedings. Keep giving your kitten his bottle until you're sure he's getting enough nutrition eating on his own. Leave out only what your kitten can consume in a 4 to 6 hour period. You don't want your kitten eating spoiled food. Keep watch on stool and urine during the changeover period to assure the kitten is adjusting well to his new diet. Try to buy high-quality food for your kittens from pet supply stores. Much of what's sold in supermarkets is junk food and may not help your kitten thrive. Changes in diets or certain foods can cause diarrhea, so please keep an eye on stools. Diarrhea and the resulting dehydration can be life-threatening to a young kitten. Besides food, warmth, and help with going to the bathroom, your kitten also needs emotional closeness. Pet him frequently and let him snuggle against your warm skin as often as possible. Through your love and hard work, you now have a healthy, well-adjusted kitten as your own companion, or ready to find a new forever home. Please make sure you spay or neuter your kitten. Kittens can be safely neutered as early as 2 months of age and weighing 2 pounds. For information on low-cost spay-neuter clinics in your area, please visit www.ibokrescue.org.
When I found them, they'd been probably 18 hours with no food, no shelter, and they were pretty cold. And we all warmed them up, and look at this. What I have to emphasize here, anybody who's watching this, is that you need patience with these guys. You know, they're in our world. They don't. And I certainly don't look like the mom he thought he was going to get, probably. And these guys were about half the size you see here when I got them at 1 day old. And I feel at the 2 week point 4 or 5 days ago that they have a, I don't know, 99% chance. You know, before who knows, they were so tiny and fragile, but now I can see that they're regular little kitties, so we're on our way really well. Buddy, 18 days old. You're going to ask me again later if I would do this again. What do you think?
Thanks again for watching this video and for wanting to do the right thing by saving the lives of your found kittens. Without your help, these little ones would have little chance at survival. But with your help, they now have a good chance at a healthy, happy life.